Glue ear is a buildup of fluid in the middle ear and is a common cause of impaired hearing in children. Let's have a look at how the ear works. The ear is divided into three parts: the outer, middle, and inner ear. The outer ear is made up of the auricle, which is the part of your ear you can see, and the external auditory canal, a short passageway inside your head that ends at the eardrum, a thin membrane that separates the outer and middle ear. The middle ear contains three tiny bones, or ossicles, known as the hammer, anvil, and stirrup. When sound waves hit the eardrum, it vibrates, which causes the linked bones to move and pass on sound waves to the inner ear. The hearing nerve picks up the sound waves and sends signals to the brain, allowing us to hear. So what causes glue ear? The middle ear is normally filled with air and is connected to the back of your nose by a narrow canal called the Eustachian Tube. The tube is closed most of the time and only opens when you yawn or swallow, allowing air to move into the middle ear, and therefore keeps the air pressure on both sides of the eardrum the same. If the Eustachian tube becomes blocked or swollen, it can stop air from getting into the middle ear, causing a vacuum that draws fluid into the area. This fluid becomes thick and glue-like over time and prevents the ossicles from moving freely, which reduces the flow of sound waves to the inner ear and affects hearing. In most cases, glue ear clears up without treatment, and doctors normally suggest a period of watchful waiting to see if it clears up on its own. However, if it does not go away, or if it keeps coming back, your doctor may suggest an operation to insert a small tube called a grommet. Grommets are not a cure for glue ear, but help to bring air back into the middle ear, which improves hearing. The surgeon will start by making a small hole in the eardrum and draining away the fluid. The grommet is then placed in the hole, which allows air to move in and out of the middle ear and the ossicles to move freely, thereby restoring hearing. Grommets usually fall out after 9 to 15 months, and around 30% of children who have had grommets inserted will need them replaced.